Welcome back to Good Morning Black Hills. September is Suicide Prevention Awareness Month, and here is why that matters. In 2022, suicide was the 11th leading cause of death overall in the U.S. and the second leading cause of death in individuals 10 to 14 and 25 to 34. The third leading cause of death of ages 15 to 24, and the fourth leading cause of death among those 35 and 44. To tell you more this morning about reducing the stigma around suicide ideation is Amber Rodner, the Assistant Program Director of Family Pathways at West River Mental Health. All right, first of all, thank you for joining us here on Good Morning Black Hills for such a tough topic to talk about. So really quickly, when we're talking about reducing the negative stigma behind suicide, what are we talking about here?
I mean, we're really talking about, I guess, in a sense, normalizing suicidal ideation and how common it is. In addition to the stats that you shared, there's actually another one that I found really staggering, which is that in 2023, 12.8 million adults, and that's just adults, reported having suicidal ideation. That's a large amount of people. And again, that's not looking at our kids, our adolescents, and things like that. And so it's important for us to talk about that. I guess it is common, unfortunately, and also to help kind of reduce some of the myths, the beliefs around suicidal ideation.
Right. And you mentioned myths. I mean, what are we talking about here? What kind of myths?
I think one of the biggest ones is typically that idea of, like, if we ask someone about suicidal ideation or if they're experiencing it, that's going to cause them to think about doing it, or it's going to increase the risk. And what we actually know is that it reduces the risk because they have someone to talk to about it. Right. Yeah.
And then if someone wants to help out with that, I mean, how can they? I mean, who should they seek out for help, first of all, but and also how can they help?
I mean, the public at large can help just by being there for them, by really understanding that this is a common problem that people have, and being willing to listen and be a part of just that connection for those people is really incredibly important. And then as far as like actual, obviously professional mental health help, is to reach out, go to West River Mental Health. We've got multiple offices. We have Pivot Point, which is for adults in crisis. We have our office at 350 Elk Street that people can come to when they have some type of crisis. There's lots of different options available, but just to know you aren't alone, and that there is definitely hope and help for that.
Excellent. Well, thank you for joining us here on Good Morning Black Hills. It's been a pleasure to talk to you about this topic.